Hey friends, welcome to Child Life On Call. My name is Katie Taylor. I am a mom and I'm a child life specialist. If you're listening to the podcast today for the first time, welcome, and we want you to know that the conversations we have here are designed for parents whose child has received a medical diagnosis. I know it may feel extremely terrifying and world-changing even, but you're here now, and you're about to hear from another parent who has had the same feelings that you do right now, and they're still standing. They had the courage to come here and share what it was like for them, to hopefully make it a little bit easier for you. I'm so grateful to each and every guest and each and every listener who shows up here. And it's my privilege to host this sacred space. Well, I'm so thrilled to have you here, Dr. Maggie Kang, but I promise I'll call you Maggie, just to learn a little bit about you and being such an advocate, not only for your daughter, but for yourself and for other caregivers and parents out there. So I'd love if you could just introduce yourself to our listeners.
Sure. I am Maggie Kang. I'm a mom with a child with a rare disease called Neuromyelitis Optica Spectrum Disease, also known as NMOSD. She was diagnosed at age 8, and that's probably the start of the journey that we're going to discuss today and all of what I've learned. I'm also by training a physician. That probably adds like a different kind of layered, unique perspective to my experience.
Sure.
And yeah, I guess that's a good place to start.
That's a perfect place to start. And kind of spoiler alert, one of the things I love about your story, and we've similarly had another physician on the podcast before, Dr. Maureen Michelle. Her daughter was diagnosed with cancer during her residency, and she
Mhm.
ended up becoming a life coach. So, kind of similar path to you. And she has found herself on a similar mission. So, I need to connect the two of you because I think, yeah, you would have a lot in common. But I would love if you can kind of take us back to the beginning of your instincts or what was coming up for you noticing that something was going on with your daughter that wasn't right?
Well, her symptoms came on somewhat sort of non-specifically and fairly rapidly. So I remember it was the winter and we had come back from a ski trip and she was feeling nauseated and feeling very fatigued. And we were sort of going back to school at that point. And let me tell you, my kid does not fake sickness. She loves school. She's never missed a day. And actually, she's so robustly healthy. She's never even been on antibiotics, never had a sort of a
Wow.
strep or any kind of infection that required that. So in my mind, she was fine. And probably this was just sort of a, viral sort of gastroenteritis. So that was kind of what we went with. But when it wasn't
Right.
getting better and she started to progressively get more fatigued and dizzy, I knew she wasn't quite right. And
Yeah.
so after visiting urgent care and our general pediatrician, we decided to take her to the ER. So in the middle of the night, January, we're at Inova, that was the hospital in our area.
Yeah.
And I remember I was walking her in the middle of the night in the freezing cold from the parking lot into the ER. At that point, I was practically having to carry her and I was getting very
Yeah.
scared. It was so unlike her. So fast forward our ER experience, it was very useful. I think at this point that I was a physician because I knew the radiologist on call at the hospital. So we were able to sort of fast track her onto that because when the neurologist saw her, they said, oh, she needs an MRI. And I was like, okay, all the way up until here, the tests have been completely negative. So I'm thinking, okay, this is just something a bit odd and we'll get past it and it will be fine. And I'm calling
Yeah.
all my doctor friends and I never call my friend an ENT out in Michigan. I was just wondering what is happening with her dizziness, what's going on with her nausea. And
Sure.
so there we were. We went to the MRI, and that was kind of like when my moment changed. And I think I talked about this in my TEDx talk where I was watching the images as they were coming through the computer, and I was thinking it was so abnormal. I was really shocked and thinking at first that this was not, it can't be her. And so,
Right.
but I had to brace myself because I almost sort of like lost my stance, sort of like
Yeah.
against the computer table, and it was at that point like 2 a.m. And so I had to call my
Yeah.
husband, and I remember just feeling like something is very wrong. And in this moment, I knew our life had completely changed. In
Yeah.
my head, I didn't know exactly what it was, but like major categories like lymphoma, infection, inflammation, and it turned
Yeah.
out to be inflammatory. But I think, maybe as moms, we always sort of like jump to the worst and
Yeah.
being this is the worst diagnosis. We may not even survive, and I'm the
Yeah.
worst mother ever. Like those were sort of thoughts that were coming through my head. And so it was horrible. Like probably the single most traumatic moment and experience of my life, even till
Mm. Oh, I can see the emotion even come back for you as you're saying and you're reliving this experience, like, physically about to fall down when you're seeing this come through. Do you remember at all how the staff interacted with you, during that time?
oh, that's such a good question. I do. Because number one, I wasn't even supposed to be back there. And they
I was about to say it's not normal for parents, but at the same time, like, if you're a physician and you advocate and you ask the question.
right. But I wasn't a physician at that hospital, so I was
Okay.
really not supposed to be back there. But it was, of course, not past midnight. It was the
Yeah.
overnight tags, and they were kind of
They're
like,
like,
okay,
"Come on
whatever.
back."
Well, they weren't that welcoming. I just kind of went. And so, but my friend, the radiologist, was also in the nearby reading room. So there was something,
Yeah.
conversations that had occurred. But I remember the tech at first irritated by my presence, understandably, saw the images come through, and I think immediately had great sympathy for me and just
Mm,
knew something was very wrong and could see by the look on my face that I knew something was very wrong. So at that point, it was just intense silence, I guess. There was nobody trying to push me out of that room. It was just
mm,
very grave. And so I just grabbed the phone. I remember I was calling my husband. I was calling my friend, the radiologist. I was like, when can I come back to the reading room to review the images? And it was all sort of like just the chaos, intense emotion, fear, just everything sort of descending upon me at one time. And
mm.
it was really something I don't wish to relive.
When you think about after that kind of intense moment of trauma and finding out what was happening, which mode did you find yourself go into? You talked a little bit about some of the themes that are replaying in your head. Did you go to like, let me figure out every possible thing, let me talk to every possible doctor? Or did you find yourself kind of sit back and say, I need time to process what's happening?
I definitely didn't do the processing, probably more
Yeah.
choice A. And the whole time, I think it was like two sort of thought processes happening. First is let me understand and figure out what is happening. And the other part was, what did I do wrong? Should I have taken her to the ER sooner? Should I have
Mm,
thought about these things sooner? Why didn't I do XYZ sooner? This is somehow me. And so those were the two sort of ways I was thinking about it. So, in terms of the first path, the first thing I did was talk to radiology, my friend, and then I talked to my husband, who is, by the way, also a physician. And then
okay.
we talked about all the logistics of getting her admitted. Where is she going to go? What's the
Mhm.
next test? And how is she going to deal with all of this? And at this point, she's still sedated, and I was thinking, I didn't know how to explain it to her. So thankfully, she was actually so fatigued and kind of like in and out of consciousness at this point. Like she wasn't really asking me that many questions, but I
Yeah.
was just there. So I knew the sorting process was going to happen, but I at this point was not, I guess like I just wanted to make sure this wasn't cancer. That's for some
Yeah.
reason in my head, that's like the first thing I go to. And it's probably because my mom had died of cancer a decade before. And that's like the whole time I'm thinking, we're just going to go relive this and this is not going to end well. So,
Mm.
not very optimistic, I know.
Yeah, I think it's hard for moms when you're faced with something like that to go anywhere. Like you said, you either go to death or cancer or what's the worst case scenario. It's kind of a way for us, I think, to prepare ourselves for what may come. Just literally the last call I was on, she was like, "I was for sure it was a tumor," right? It's like that's just where your brain goes to.
Yeah.
Um, so you get her settled, in the hospital. I imagine that they probably admit her right away. And how do you navigate that stay?
Well, the first thing she had to get was a lumbar puncture, which really, for some reason, upset me because even though it was definitely necessary, it was actually the way we obtained the diagnosis finally. I was thinking, oh gosh, this is going to be really uncomfortable for her. And I was like very mad that they didn't keep the sedation from the MRI on board for that
Yeah.
LP.
Yeah. Uh-huh.
I just didn't understand like why you had to sedate for the MRI, but you couldn't sedate for that. So I actually convinced the guy to give her an extra bit of sedation, and he somehow agreed to that. And I also found and I actually had to be a resident, which at this point was fine. It was in the middle of the night.
Yeah.
And he had already done a series of LPs. Like he'd gone to Africa and he was on some kind of a mission where he was doing, hundreds of LPs on these kids to
Yeah.
attain diagnosis for whatever that mission was for. And so I was like, okay, you're the guy. And so let's do this. And so, we prepped her and everything. And so I felt like once we got that, I don't know why I thought that was, like, such a relief because she was still
Mm.
sedated, but she still actually felt pain and that, like, caused me so much pain that she felt some discomfort, but after that and I don't even know what question I was answering with that, but I'm
Yeah,
trying.
we were going on to the hospital, and I wanna pause just for a couple things that I
Yeah,
love that you brought up. And one is that as a child life specialist, when we see families in the hospital needing 2 different procedures in the same day, our first thought is like, "How can we bundle this
yes.
to do as least harm as possible and keep the child as comfortable as possible?" So we'll be literally in pre-op begging the anesthesiologist to draw labs because we know labs need to be done later this day and kind of advocating. And your exact instinct is right. Like, if she has to have something painful done and she's already asleep, why do we have to have her go through this whole recovery process, then
Yes.
go through something painful?
Oh,
So I love that you had that instinct to advocate for that. And I want other parents who are listening to this know, how can we bundle things if there are going to be multiple things happening in one day?
oh, 100%, and that's actually one thing that I talk to our foundation about, which we'll get to. As
Yeah,
an advocate and a coach, this is what I do when I talk to parents and patients who have not only rare disease, but chronic illness. It's just like there's so many specialists involved, and everybody wants their own set of labs on a different timetable. And I'm thinking, no, that we need to like get this all together. And so sometimes we as moms have to be the quarterback.
you
And
do.
so I'll say, I don't want my kid to keep missing school to get labs. So we're going to do it at this one time. And everyone's just got to put their lab orders in at this time. And even though that's slightly off schedule, it doesn't matter. I mean, unless it's like a critical lab piece, which for us has not been the case. It's now a lot of follow up, but I'm
Sure.
thinking, absolutely. Even lab draws should not be multiple. They should be one. And it's so hard actually even to get my daughter's veins because they're so tiny. They
Yeah.
roll and actually only trust the folks at Children's. Like I drive all the way to Washington, DC to get the very skilled ICU nurses to obtain her labs.
I mean, when you find out what works for your kid and your family and your peace of mind, it's worth the extra input. So I'm sorry I didn't want to take you away from your story, but I thought that was so great that you advocated for that. And here's the caveat is you can always ask. You may not get the answer that you want, but you're going to get really good at practicing asking for these things.
Oh, it's so true. And then just kind of understanding why and how things work and what their
Yeah.
priorities are. So when you go to the hospital the next time, you can kind of already have a game plan in place and say,
Sure.
okay, well, before we do that, let's, why don't you just go ahead and bring this consultation person in? Because if they want to add labs, like, let's just wait. Let's not do the draw until we can be sort of like as like efficient as we possibly can.
Now in the hospital, like reality setting in, you're starting to get answers. She had that LP. Were you able to get a diagnosis right then and kind of start treatment, or how was that process?
They had to send it out to Mayo Clinic. And I think
Okay.
at this point, they had really no sense of what could be wrong. So it was just like, just battery of tests. Let's just go.
Mm,
And I think at this point, they were entertaining a lot of various ideas. Like one of them was anti-NMDA type immune encephalitis. But so they were asking me all sorts of questions like, has she changed her personality? Is she psychotic? And that type of thing. And I was like,
yeah.
no. But I was thinking, okay, I kind of knew what they were worried about. But then they were looking for just like odd things too, just weird tumors creating antibodies that could cause something. And I was like, okay, let's just do it. And so we had
Sure.
ultrasounds of everything. We had a lot of tests. And this went on for probably like, I would say a solid 2 weeks, but then she had aspiration pneumonia. So let me back up and tell you that the way her disease had manifested, as I said, was the nausea and the dizziness because it had affected this certain area in her brainstem. And a lot of her cranial nerves coming from like the bottom of her brain were infected. So she had paralysis of her tongue. She couldn't
Mm.
swallow. And at that point, then she couldn't speak. And then I had her write to me on a whiteboard to
Mhm.
communicate. And then she had paralysis of her right upper extremity. So a lot of very sort of weird things were happening very quickly, and we were all getting very scared. Because she couldn't swallow, she developed an aspiration pneumonia. And at that
Mhm.
point, things started to really escalate, and her condition became slightly unstable as her pneumonia developed and possibly sepsis and all
Mm.
that. So, she was in the ICU for weeks for that, and because she couldn't clear her secretions, she was doing all of these, like, intensives, therapies to, like, try and get her chest to produce sputum and to get things sort of moving this way, not sort of settling into her lungs to develop
Right.
more of an infection. So, we went into that process where at that point, it wasn't even so much about the diagnosis, about getting her past this acute episode and hopefully
Mhm.
out of the hospital and to stay alive. So we moved through these stages very quickly, and there was really no time, back to your question about processing, to really process emotion. I was just kind of panicked and really panicked and just worried for her life. At this point, she also lost 20 pounds, and it was just like one thing after the next. So ultimately, this is one thing that was actually very good for us. The way things had been moving on, I was not super happy because there seemed to be like no movement toward getting a diagnosis, and also it didn't seem like it didn't seem like they were really communicating with us what their plan was. So we had a woman at our school who is actually a very big sort of donor to the I know the children's pediatric system. So she called the head of pediatrics at Inova, and this is what kind of, I guess, accelerated the process of diagnosis, if you will.
Sure.
So the next day, he came down the hall. I could see him, and I was thinking, "Oh, who is this?" It's like a totally new face, and he was carrying a whole bunch of paperwork. He talked to various people, and he said that they were going to send our case to Washington D.C. for the grand rounds. And I thought, okay, finally, we're going to get like
Wow.
a lot of people, doctors thinking about this at grand rounds. And I know what that means. It's like, it's an unknown case. A kid is sick. Nobody knows what to do. So you send it to grand rounds. So you get all of these different minds on it. And
Sure.
so I was so kind of grateful and hopeful at that point. And so at that time, it was a doctor at Children's National who recognized the images and suggested the diagnosis. Once she suggested it, that was what changed kind of the treatment plan. I
Mhm.
think at that point, the suspicion was so high, even though we hadn't had a confirmation from Mayo, that I think we started at that point presumptively treating her for this disease. And so that's when things started to improve. But we really were in a very bad position. And I sort of like I worried when I shared this story because I know that not everybody has access to that kind of like friend or person, right?
Yeah.
And it's like it saddens me to think that this is what is necessary to get things moving.
Mhm.
But the reality is, for most people with our disease, the diagnostic journey is longer.
Sure.
And for us, it was shorter, thankfully, because this person got involved.
And just because of what I know you would tell yourself, because you advocated, you got her presentation at this grand rounds, you got a diagnosis. Now maybe dozens, potentially hundreds of people know about this very rare disease because of you advocating.
Oh, I hope.
So, right? Otherwise, if it didn't get in front of all of these faces, it would have just lived in this doctor's brain for whoever knows how long. But because you did advocate, now more people know.
Well, that is my hope. And for sure, I feel like in the neuroimmune community, our disease is much more discussed now. And actually,
Mm.
it's incredible just in the span of probably like 6, 7 years, I would say, that our disease has become very well known. Like it's being presented at neurology conferences. There's a special neuroimmune association that talks about our disease, something like multiple sclerosis, which has been around and well known for many, many years. But then there are other sort of neuroimmune diseases that are sort of in this umbrella of neuroimmune diseases. And there are, Facebook groups on it. There are special conferences on it. So it is really exciting that that is the case.
How long ago was your daughter diagnosed with this?
2018.
2018. Okay.
Yeah.
So it really does kind of correspond with your advocacy efforts for it becoming on the map. So I think a lot of parents could thank you for what
Right.
you do. I want to hear kind of about
Yeah.
you started getting the treatment and she was able to go home. And probably then a lot of people say, parents say, it's after you leave the hospital that you start processing like what in the world just happened. And I would love to hear kind of how your new trajectory of Maggie came and
Yeah.
learning about life coaching.
Right. Such a good question. I often tell people that it's the time after the hospital when things become quiet that actually is probably even more difficult because
Mm.
when you're in the hospital, you're in sort of a hyper adrenaline state and you almost don't kind of like know what's going on. You don't feel, you're just kind of like trying to survive the moment, the day. And you just pray to God that your kid is going to be okay. And then you come out of the hospital and it's like, it's quiet. You're alone. So there's so much emotion. Like I would say guilt, anxiety, loneliness were my primary when I was at home. And lucky for us, we were sort of going into the pandemic. So that's
Mm.
sort of magnified and really amplified that feeling of aloneness. And
Yeah.
so I felt like I wasn't necessarily processing in sort of a healthy manner, I would say. I
Yeah.
think I was still avoiding. And this was actually so interesting because I was listening to a segment that you were talking about with someone on the podcast about grief. And
Mhm.
I think that grief does take on so many different forms. I mean, my daughter didn't die, but there was a loss, a huge loss of the person that she once was, like her robustly healthy, active life. And she was this competitive lacrosse player, she's a competitive swimmer, and she was so strong. And when that was no longer the case, like she came home in a wheelchair, she was not eating solid foods and she couldn't bathe on her own, like, it was she was a different person, she had lost 20 pounds, I mean, really, my heart was just breaking every day seeing her struggle, but in my head, I was still, for some reason, holding on to this idea that, "Oh, we should get back to that life."
And now a word from our sponsor. We're so grateful to have Payne's Instant Topical Anesthetic Spray as our sponsor of today's podcast. Help control pediatric procedural pain associated with needle procedures and minor surgical procedures while improving patient satisfaction. Payne's Instant Topical Anesthetic Spray works immediately. It is a non-drug and non-flammable topical spray that can be used to temporarily relieve the pain associated with minor surgical procedures and needle procedures. Pain Ease is a medical device and does not contain medication. It can be a safe and effective alternative for lidocaine injections when used to temporarily control pain associated with immunizations, IV starts, blood draws, foreign body removals, and suturing or suture removal, to name a few. Pain Ease works on a 3-step process. First, prepare the site and equipment for the procedure per your facility's protocol. Second, apply Pain Ease by spraying about a can's distance away for 4 to 10 seconds or until the skin begins turning white. Finally, perform the procedure. The anesthetic effect of Pain Ease lasts about 1 minute and can be reapplied as many times as necessary. Refer to application instructions for full details. Important risk and safety information. Consult your pediatrician when using on children 4 years old and younger. Do not use on large areas of damaged skin, puncture wounds, animal bites, or serious wounds. Do not spray in eyes. Overspraying may cause frostbite. Freezing may alter skin pigmentation. Use caution when using product on persons with poor circulation. Apply only to intact oral mucous membranes. Do not use on genital mucous membranes. The thawing process may be painful and freezing may lower resistance to infection and delay healing. If skin irritation develops, discontinue use. Caution: federal law restricts this device to sale by or on the order of a licensed healthcare practitioner. Studies suggest that pain ease does not induce vasoconstriction, does not contaminate a site that has been cleansed, and is preferred by patients and practitioners. Pain ease comes in 2 different spray pattern variations, medium stream and mist. It is also available in 2 sizes, 3.9 ounces or 1 ounce single patient. Gebauer appreciates the care and comfort that you provide to pediatric patients. Visit gebauer.com/pain ease with no space to learn how pain ease can make visits more comfortable.
We're just gonna get better, get you on your meds, like, we're gonna recreate our life. This was my, I think, hope, and though probably unrealistic, this is what I was somewhat clinging to, and I think this was probably the start of what I think I described as the suffering.
Mm.
It was like my inability to accept truly what we had lost, and this is the part that took me probably a solid, like, 2 years, I would say,
Yeah.
really, really come to terms with that. And there was a point at which when I realized, like, oh my gosh, we may not actually be able to go to school. I was entertaining homeschooling. I was looking at programs for kids who could just go to like 1 or 2 classes a day. I mean, it was so just it got so crazy, like how our lives had shifted and potentially could shift more. And I just it,
Mm.
like, scared me so much to think about that down the road. So, I would say that looking way too down the road is probably not, super
Mm.
helpful because you can't control what's going to happen. And so, I think for me, when I finally hired a coach, I was on this sort of physician Facebook group. I think I was starting to discover the rare disease community. It was the first
Mm.
time I was actually on social media, and I started learning about coaching and how you think about things. And so that's when I hired somebody and I started to learn about, yeah, the importance of processing, how you think about things, and how that perhaps I was actually creating more suffering than I needed. And specifically, what I mean about that is that I chose to kind of create this narrative about how it was my fault that she had gotten so sick, that I should
Yeah.
have done something, I should have recognized something sooner, that I was her mother, that I was a physician.
Mm.
And so this was the story that was going on in my head, and it was creating enormous amounts of guilt and anxiety. But really, what I was doing was avoiding the acceptance of
Mm.
truly the loss and the grief of who she was before. And like the life that I had created in my head about what we were going to be doing like next spring, going on tournaments, and how she was
Yeah.
going to be this robust student athlete. Like, I guess it was like dreams that maybe that we have as parents or moms. And
Yeah.
when that is done or sort of different, I think it's we need to accept that. And it's only in the acceptance that you can move forward. That's what I learned.
Mm. It's so difficult. It's like until you truly live it and have to process it, it's just so hard. One of the things that I just keep hearing from you is this like roller coaster of like, okay, seeing the images and being like, okay, our life is going to be changed forever. And then it's like you come home in a wheelchair and it's like, we're going to get back to what we were. And then it's like, oh no, we're going to be able to go to 1 class a day and now our life is totally different. And now you have this whole other perspective. It's
Yeah,
exhausting on so many levels.
it is. It really
And the mom guilt, I've been in the trauma bay next to a mom, whose child is being worked on because of a peanut allergy. And she thought, I'm the mom. How did I let that, happen? And it's not at all her fault, right? When we see these, it's not her fault, but it's the experience and very normal, I think, for moms and dads to say, "What did I do? How could I have changed this outcome?" It's normal and it's really, really painful.
it is so painful. And I get it, and I don't know if it's somehow like conditioning of society for moms to bear such a tremendous burden of guilt because we have
Uh,
such a huge responsibility. But I think it's also important to take care of ourselves, and guilt is in no way self-care.
oh gosh, you're so right. And the way that you're sharing, you're being so honest and vulnerable about how hard it was at the beginning, about the processing couldn't even take place, that you were just living minute by minute. So I think that brings a lot of comfort to those who are like, I don't even know how I'll get out of this dark hole.
Yeah. How do you get out of bed? But then you have to because
Mm.
Your kid needs you.
Yeah. Yeah. Talk to us kind of about this I'm saying rebirth, but I didn't really know you before, but it just seems like first of all, there's no mom like a rare disease mom, and I'm sure you've learned that now being in the rare disease community. Like, oh my gosh, the most amazing moms and parents from this community that fight for change and get clinical trials going and like source people from the other side of the world to help their child. How has that with life coaching kind of created the life that you have now?
Wow. So this is the great sort of beauty of this world, I guess. Rare disease specifically is what I'm talking about. And you kind of alluded to it. Yeah. It's interesting because I have to say, before I start talking about that, once when Nell got better and she started to experience also the people in rare disease and all of the great sort of inspirational everything really that happens in this community, I asked her, I was like, if you could just take all this away, like what if you could just be the kid that you were and just be totally healthy and none of this would happen? Would you accept that? Would you? And she said, no. And she said that she'd rather know this life, even though
Oh,
it requires living with this disease. Yeah. I mean, I was
oh
like,
my gosh,
wow.
that gives me chills and tears, and what an amazing daughter.
I know. And so she really is. And so I just wanted to start with that because it just gives you sort of a little bit of an insight into how our life experience has changed.
Yeah.
And I want to say, and that's not to say that our life before was bad, but it was sort of defined by like, it was fun. We were going to parties and she was doing all the cute, like tween things and sleepovers and tournaments and all of that. But it was also very much defined by like, get on this team, go to the next practice, go to this tryout. You have to be there for the school thing. And, there
Sure.
was just like this never ending cycle of like, do this to like make sure you stay on track kind of feeling.
Yeah.
But I feel like in this rare disease world, we were opened up to a world of people who are so deeply caring of other humans that they may not even know, who are suffering in the same kind of way. And to your point about mothers, like, yes, I'm so blown away by the commitment, the dedication, and the love of so many of the moms and the dads in our communities. And I will say that one of the reasons why Nell is on her current FDA approved medication for pediatrics is because of the work of one of the moms who had a daughter with Nell's same disease about 10 years before Nell was diagnosed. And because of her work, a lot of the research and innovation had already been happening. So by the time Nell needed to be on this drug, it was like approved at the time that she needed it. So that was done by another mom. And I just can't even believe how fast and how impactful all of that work was. And so being around people in the rare disease community has changed our lives. And I'm actually very excited because Rare Disease Week is coming up in February. So we will be there for the third time and interacting with all these people. And even though Nell's in high school and it's so hard for her to miss so much school, she's so excited and it's 100% worth it.
Absolutely. When do you remember the first time you met another parent with a child who had gone through something similar, and what was that like?
Yes, it was. I remember it was through our foundation, and there was another mom who had a daughter with Nell's disease, and we had a Zoom conversation. And I remember feeling like, wow, I didn't know that there were so many of us to connect to because it seemed like, so the disease that now has actually, it attracts more adults than kids. So I knew it was rare, sort of, even in the adult world, but I didn't know that I could find other kids that actually had her same disease. So this was just kind of amazing, a small miracle. And then we became ambassadors to this foundation, this Meyer Foundation. And so then it's through that we've been meeting other moms with the same disease and much more patients with her same disease. So I would say the moment that I talked to her, it was special. And I learned so much because they were ahead of us in the process and that things were going okay for them. So it brought me a lot of hope.
Mm. What have you learned about yourself through all of this process?
Yeah, incredible. Things have changed about me. I would say that it's probably all really good changes, to be honest.
Mm.
One thing I learned is that I always knew I was strong because my mom is strong, my grandmother was strong, and I just knew that was a part of me. But I didn't know the degree to which I could kind of transform myself to be a better or sort of stronger mom for my daughter. So, a specific example is the TEDx talk. I am not somebody who would choose ever to get up in front of people to share anything personal or emotional for that matter. So up until then, like the only types of talks I had given were medical conferences, which is really in a dark room. If you think specifically because I'm a radiologist and I'm looking at images, that's it. And nobody knows anything about me. They don't actually even see me.
Yeah.
So the idea of me getting up on stage, sharing a very personal story, it's like so unlike me. And so
Yeah.
the fact that I not only decided to do it and went through the process of getting myself on stage, which by the way is not easy,
No.
and then getting myself on stage is something that shocks me and anybody who knows me. So I will say that what I learned is that I have a much greater ability to transform myself when needed than I realized.
Mm.
And to be honest, I like who I am better now because I'm not as scared of
Yeah.
life.
Yeah.
And I feel like I know how to survive and I know my daughter knows how to survive. So these
Yeah.
are really, really amazing things that I've learned along the way.
Well, I'm so grateful that she inspired you to get up and talk and share, and that I get to know you now and be connected to you. I would love to learn how other families or how you support others, what you're doing now, how people can connect and get to know you.
Well, I am, as you mentioned before, a life coach now. And I've actually completely stopped radiology practice. And so this is what I'm fully committed to this and
Wow.
advocacy, the work I do with my daughter. So the way I work with patients and families and caregivers, primarily moms and dads of kids with chronic illness, is number one with the mindset piece and understanding that what really grief is. It's not that you're somebody has to die for you to feel grief. It is the loss of like really anything. And really accepting that and getting to a place of prioritizing self care, which is not something that I ever thought was important. And the other piece of what I do is I help people navigate healthcare. And this is, I think, this is like a little bit more tangible, like the second piece, because I show people how to fight health insurance denials. In fact, I just wrote an op-ed. I'm going to submit it to hopefully someone that will publish it. But even just
Amazing.
in the wake of the shooting of
Mhm.
United Healthcare CEO, I feel like it's raised a lot more sort of awareness and created more discourse on a topic that I feel like has been in existence for decades. I mean, I'm not really sure why it's so hard to get coverage for things that are medically necessary. So that's one huge thing. Also, how to talk to your doctors. Also, how to organize your medical information, the data, and what's important, and how to utilize that time that you have with the healthcare provider maximally, and to really understand all the pieces of what you're dealing with, why you're getting a lab test, why you're doing a follow-up radiology test. I mean, I think that just understanding puts people in a state of mind of confidence and feeling like they have a handle on their situation. It's not like they're a victim of receiving a diagnosis that could define the length of their life, perhaps. And so I think that this is both pieces are very powerful and they work in tandem, really, because
Mm.
mindset piece helps you understand that you can choose to have agency in this situation. I mean, terrible things happen in life, but you can choose how to respond. And I help people get to that place of if you want to choose, like recognize your agency, I can show you how to do that and how that's
Mm.
important. And this is the most important thing for parents specifically is that once you do that, you show your kid how to do that. And
Mm.
this, I don't know if this was brought to light as strongly as I wanted to on the TEDx talk because that talk, by the way, started out being like 20, 25 minutes, and I had to condense it to 10 minutes because that's TEDx. And
Yes.
so I really like one of the ideas that I wanted to underscore is that I think that when, as parents, we go into this, we're like, oh my gosh, we have to save our kid. We have to do everything for my kid. Like, I don't matter. It's just everything is for my kid. But the truth is, you matter because how you are impacts your kid. And I feel
Yeah.
like this is the part that we miss as parents all the time. And I did too, completely. Like, I thought as a mom, I should, it's like,
It's like we have to be martyrs.
kind yes, that,
Yeah.
exactly. And I'm thinking, it doesn't have to be one versus the other. It's kind of like if you think, "Oh, you're caring for yourself, then your kid gets less care." It's not that. It's not like a
Mm-mm.
zero-sum game. It's really the more you take care of yourself, you show your kid how to do that and the value of that. You also teach your kid that they can actually not feel guilty in the fact that you're caring for them. That was one of the things that Nell said to me. Like, she felt
Oh,
so guilty that I was so stressed. So when I started to care for myself, she felt better because she could see that I was good and she didn't have to worry about me. And that's just what
oh,
she does sometimes. And when I started to eat better and sleep better, she did too. I mean, it was
yeah.
very remarkable to me, like how quickly I saw the transformation in both of us. So now moving forward, it's almost like you can like raise the bar on the quality of the lives that you have. And
Wow.
so I think this is really like a key piece that I learned over the course of 2, 3 years. And I hope to teach people it sooner in their journey so they don't sort of, I guess, suffer as long as I did. If that
Yeah.
makes sense.
It does, because a lot of the conversations I have with families when in the hospital is I walk in and I'm like, "How did you sleep last night, mom? When is the last time you peed?" Like, right? Like, "Did you leave the room today to go downstairs and get a cup of coffee? Like, who is coming to take care of you?" And really just kind of quietly but insistently saying, "You have to take care of yourself. I know it feels like you cannot leave this room, but you actually have to, and it
Yeah,
will make you better when you return. And
exactly.
what can I do to support you so that you can go do what you need to do and feel comfortable?"
Yes, I know. I love the child life specialists. And the nurses
Well,
are pretty sensitive to it too. It's great.
oh, beyond. Yeah, and you feel that when you have a team taking care of you. Well,
Yeah.
okay, all the wonderful things you do, what is your website, the name of your foundation? How do people find you?
Okay, so my website is www.maggiekangmd.com. If I have a newsletter that I do for caregivers, and if you want to subscribe to that, it's just basically my website, maggiekangmd.com/caregiver. And if you subscribe to that, you'll get like a little thing where I had to go through tips. Like I think I give you 3 tips. And this I took from this article I wrote for Psychology Today that seemed to resonate with a lot of people over the holidays. But prioritizing self-care is one, recognizing your agency is another. And the third one was that you can like just ask yourself like what is this whole experience here to teach you, just sort of like understanding the meaning behind it.
Mm.
It can really reduce the feeling of what could feel very burdensome in the experience of long-term caregiving, and it give you like very specific ways you could address all three if that is useful. If you sign into that, the newsletters through that particular link, it will also give you an additional PDF that I so you'll get 2 free gifts if you want.
I love why my last question for you is how do you take care of yourself, Maggie?
Well, to be honest, having these conversations and being a part of the rare community and coaching other people all kind of gives back to me. It's like it reminds me of what's important and just like the human connection with people who are sort of in my space gives me a lot of self-care. I love
Couldn't agree more. It's the secret sauce when you're working a job that actually fuels you,
Yeah.
and it's pretty amazing.
Yes, I think that being around people who are so loving and who are sort of in, like you have like a greater kind of goal to support other humans in a similar life experience. It is so rewarding. Absolutely.
Thank you. Well, thank you so much for being with us, and I'm so grateful to have you.
Oh, thank you. And if I may just also share that my daughter wrote a book. I don't know if I told you this, but it's
Yes.
called My Hospital Story. And the reason why she wrote it was because it was the book that she needed to read when she was in the hospital. There was really no books about, I guess, teens who are in a hospital long term and having a chronic illness. So she wrote the book, and then it's basically a series of journal entries that she converted into like little web
Wow.
chapters. So it's called My Hospital Story. The link is also on my website if you want to check it out. And yeah, we're both on social media to follow us and be a part of our world.
That sounds wonderful. We absolutely will. You guys, I have the best news. If you didn't hear it at the beginning of the episode, Support Spot, our app, is now available for every parent. You no longer need a hospital code to log in. So go ahead and go to childlifeoncall.com/supportspot and download our app today. Hospitals and child life specialists, yes, we are still partnering with you if you want to customize content or provide this app to your families free of charge. We're so grateful that you're here. When you rate and review this podcast, it helps other families be able to find us. So let's keep doing that, and I will see you again here next week. For those of you who are joining us today, I am not a doctor. I'm not a therapist. I am a child life specialist. And the suggestions and tips and resources that I talk about with parents on this podcast may be great for you, and they may not be right for you. So the most important person you can talk to about getting support is your care team, your doctor who knows your story and your child's story. So regardless of maybe what I mention or what other families mention here, we're not licensed therapists, we're not doctors. We're having a conversation about what the parenting journey has been like. So please keep that in mind as you listen today.